As a doctor or nurse, have you ever caught your patients doing something inappropriate? Alicia Vianya says, oh yes, many times. Probably the most memorable and most ethically difficult was at my first job. I had a 20-something who had been crazily ill with a major infection, septic, on the ventilator, lots of medicines to keep her blood pressure up, etc. She was much better at this point and was getting ready to transfer to the floor. It was a huge victory because a lot of us didn't think she was going to pull through. She had 3 visitors come, her significant other, her best friend, and her best friend's significant other. They made it pretty clear they wanted me out of the room, didn't participate in small talk, and wouldn't acknowledge me when I introduced myself. Whatever, I didn't care. I was just glad she was better, and if she wanted to have some private time with her people, good for her. I got what I needed to accomplish, finished, and pulled the curtain to let them have their privacy. I heard noises later. You can imagine what kinds. The friend and her significant other, and the patient and her significant other. I blinked and just let it be. I had absolutely zero desire to get in the middle of that. I thought about informing the police, but the kicker here is that the patient was HIV positive, and she'd asked me not to mention before her friends and significant other arrived because none of them knew she had HIV. Then she blatantly had sex with someone whom she stated didn't know she was infected right in front of me, in a state where it's a criminal offense to knowingly infect someone with HIV. I literally had no idea what I was supposed to do. Patients absolutely have the right to keep their personal medical histories confidential in the hospital, especially with HIV. It was also very frowned upon to call the police on a hospitalized patient. My coworkers answered with a resounding no when I asked them if I should call. At the same time, she was literally committing a felony in the room right in front of me. And worse than that, she was potentially impacting the rest of the guy's life. After a lot of careful deliberation and consultation with people with way more years of experience than me, I opted not to call. Hopefully the health department called him at some point to let him know he'd been exposed.